Sorry for that. Yeah. Is my screen is visible to you?
Yes, it's
Yeah. So whatever I have mentioned in this slide, these are the important parts of the blood bank which you have to remember for exam. As you know that in the blood bank, we have anticoagulants which is used. I mean in the blood products, whatever blood products we use, we have that in that 1 unit of blood, we have that anticoagulant is used. What type of anticoagulant you have to remember according to the shelf life. So what actually these anticoagulants do? Anticoagulants provide a longevity to that particular a blood product. So we have that CPD, CPDA, and SAGM. You might studied about this in surgery also. We have CPD, that is citrate phosphate dextrose, citrate phosphate dextrose adenine, and also we have SAGM, that is sodium adenine glucose mannitol. What you have to remember that this CPDA will have a shelf life of 35 days. CPD will have a shelf life of 21 days. Again, I am repeating, you have to remember about this. CPDA will have a shelf life of 35 days. It's already a PYQ. Now we have some blood products and their storage. You have to remember that whole blood have volume 350 ml. Volume is not to remember. What is to be remembered? That whole blood is stored at 2 to 6 degrees Celsius. Again, repeating, whole blood has to be stored at the 2 to 6 degrees Celsius, and it will be used in acute blood losses. That's obvious. And about FFP, that is fresh frozen plasma. You have to remember the volume about fresh frozen plasma. That is, it is with the 200 ml of volume, and the shelf life is of 1 year. And what will be the storage temperature? It will be less than minus one less than 18 degrees Celsius, minus 118 degrees Celsius. What you have to remember that where we usually use in the multiple coagulation factor deficiency. When you will read about the coagulation disorders, you will connect with these points that we usually use in the coagulation factor deficiency. Again, we have cryoprecipitate. First question about cryoprecipitate, you need to remember that in the cryoprecipitate, it is rich in factor 8, fibrinogen, and 1 milligram factor. Again, I am repeating, you have to remember that this CPP has rich in factor 8, it's rich in fibrinogen, or also 1 milligram factor. So where you will use this in hemophilia A, von Willebrand disease, factor VIII deficiency, and hyperfibrinogenemia. This is not important. These three are very important. In hemophilia A, because factor VIII, von Willebrand disease, obviously we have the component that is von Willebrand factor, and obviously in the factor VIII deficiency. So do remember, it's very important. About random donor platelets and single donor platelets. What you have to remember that platelets are stored at 20 to 24 degrees Celsius, but that should be with agitator. So the full answer is, or we can say the complete answer is from 20 to 24 degrees Celsius with agitator, and the shelf life will be 5 days. Okay. Obviously, we'll use these platelets in the thrombocytopenia. So what you have to remember, the shelf life according to anticoagulants, also about the whole blood, is in the 2 to 6 degrees Celsius. Fresh frozen plasma is minus 18 degrees Celsius. Same cryoprecipitate also minus 18 degrees Celsius. And as they are stored at so much low temperature, obviously their shelf life will be very high. That is 1 year. In platelets, as they are stored at the around room temperature, that is 20 to 24 degrees Celsius with agitator, the shelf life will be 5 days. Remember, very important. Also, you have to remember this all are very important question, even they all are questions. So what is important question? That 1 unit of blood will lead to increase in hemoglobin by 1 gram%. अगर मैंने किसी पेशेंट को 1 ग्राम का एक यूनिट का ब्लड दिया है, तो देयर विल बी इंक्रीज ऑफ हीमोग्लोबिन बाय 1 gram%. Also, if I am giving this random donor platelet, platelet will be increased by 10,000. Also, if I am giving single donor platelet, the platelet will be increased by 30,000. What you have to remember, that blood is screened for HIV, hepatitis B, hepatitis C, malaria, and syphilis. So you will come to this question like जब आप GT दोगे या maybe when you will give questions in exam also, तो वहां पे एक्सेप्ट का क्वेश्चन आएगा that other than this कौन सा नहीं we usually go for the screening, और अदर और या फिर क्वेश्चन आ सकता है चूज इसमें से कौन सा we usually go for the screening. Usually what we miss is malaria, we usually miss, and also we miss the hepatitis C. So हमको याद क्या रखना है? Okay, HIV, hepatitis B, hepatitis C, malaria and syphilis, these are the infections usually blood is screened for. Okay, any infection which is transmitted by all blood product is malaria. यानी कि जितने भी blood product है, for example whole blood, FFP, cryoprecipitate and platelets, ये जितने भी टाइप के ब्लड प्रोडक्ट्स हैं, they have tendency, or we can say they can transmit one particular, or they have tendency to transmit the malaria. Not all, but only the malaria. About component most prone to bacterial contamination is platelet. अब अब ये what does it means? इन सब ब्लड प्रोडक्ट में से किसी में बैक्टीरियल इन्फेक्शन ज्यादा हो सकता है, वो प्लेटलेट्स. व्हाई? बिकॉज यू कैन सी दैट द टेम्परेचर एट विच इट इज स्टोर्ड इज 20 to 24 डिग्री सेल्सियस. So you know it's easy for the bacteria also to grow because this platelet will act as a culture. This platelet will act as a culture at this temperature, and ultimately at this temperature they are very prone to have bacterial growth. That's why the component most prone to bacterial growth is platelets. What is the lifespan of transfused RBC? That is 50 to 60 days. इतना समझ में आया आपको?
जी
हाँ.
जी
Okay. Now again we'll talk about transfusion. What is transfusion protocol? That whatever transfusion is taking place, that should be commenced within 30 minutes of taking out of the fridge. Like जब भी हम एक ट्रांसफ्यू कोई ब्लड को ट्रांसफ्यूज कर रहे, जैसे ही अगर हमने उसको फ्रिज से निकाला है, वॉट एवर द ब्लड प्रोडक्ट इज, इट शुड बी कंप्लीट विद इन 30 minutes. सो यू हैव टू रिमेंबर दिस टर्म, दैट इज 30 minutes, दिस न्यूमेरिकल वैल्यू, and it should be completed within 4 hours. ठीक है, it should be within 30 minutes should start, and it should be complete within 4 hours. Also, we'll talk about the massive blood transfusion. So the name itself saying it's the massive blood transfusion. What is the meaning of this massive blood transfusion? You have to remember this definition, as in definition that replacement of patient's whole blood volume within 24 hours. यानी कि उस patient में like for example 5 to 6 liters of blood है, so the whole volume is replaced by whole blood volume within 24 hours. That will be termed as massive blood transfusion. Okay, what will be the complication of massive blood transfusion? Just think once. There will be the complication can be remembered by as catch C for coagulation, and this coagulation भी dilutional coagulopathy. Just think once, इतना सारा ब्लड हम अगर बॉडी में ट्रांसफ्यूज करेंगे, डेफिनेटली coagulation factors भी बहुत ज्यादा जाएंगे. As the coagulation factors will also be increased, so there will be coagulational this dilutional coagulopathy, which will cause DIC, that is disseminated intracoagulopathy, and this is the reason, or we can say most common cause of death. Again repeating a point, there will be coagulation defect, or we can say dilutional coagulopathy. This complete word is important, dilutional coagulopathy, that is DIC, and this is the most common cause of death, is a question. Next we have acidosis and alkalosis. Obviously there will be chances of acidosis and alkalosis, but what will be the more common? That is metabolic acidosis. Okay, if I talk about this, again we have hypothermia. As you know that these blood products are usually at the cold temperature. If massively we are transfusing this blood product, then definitely there will be hypothermia. There will be citrate toxicity. Why there will be citrate toxicity? As you can see over here, in anticoagulants we have citrate, right? So as in citrate, there will be increase in the citrate, that will cause citrate toxicity. But how we will know that the patient is having citrate toxicity? The patient will complain of tingling and numbness. Okay. Last but not least is hyperkalemia and hypocalcemia. Why there is hypocalcemia? You have to remember that this citrate, which is used in the,
combined with calcium.
yeah, exactly. This citrate actually chelate, or we can say it combines with the calcium, which is present in our blood. So that's why we have hypocalcemia. If I talk about hyperkalemia, Why there is hyperkalemia? So just think once, if this is a blood product, there is RBC. Obviously, there will be some lysis of RBCs. So this lysis of RBCs will release the kalium which is already stored into it. That will cause hyperkalemia, and this hyperkalemia is responsible for the erythemias. Okay. Now, you understood until here. It's easy, right?
Yes.
Okay. Now we have next is Trali. What is Trali? Is transfusion related acute lung injury. Again, I am stressing upon this point. It is an acute lung injury. Please repeat with me. It's the transfusion related acute lung injury.
Transfusion related acute lung injury.
Yeah. Why I am stressing upon this? Because we usually tend to miss out this point. That is in the acute lung injury. Okay. Now, the name itself saying it is a transfusion related. So there is something happening related to transfusion. That is, it develops within 6 hours. So you have to remember this numerical value, that it is developing within 6 hours. What will be the symptoms? The symptoms will be like ARDS like symptoms. For example, the patient will have dyspnea and tachypnea. Okay, the patient will represent with देख उसको सांस चलने में दिक्कत आ रहा है, उसका रेस्पिरेटरी रेट बहुत ज्यादा बढ़ गया है. So, and it is just happening like within 6 hours of the transfusion. About chest x-ray, if you will go for, then you will see white out appearance. Like in chest x-ray, you will see white out appearance. So एक clinical scenario होगा जिसमें like after 7 hours, or not after 7 hours, maybe after 5 hours, the patient will complain of like tachypnea or dyspnea. And also on investigation, you will see chest on the chest x-ray, you will see whiteout appearance. So you, and in option you can see the transfusion related acute lung injury, then you should go for this. Okay. What is the pathology? As in for pathology, what is important to be remembered is that in Trali, it's the leukocyte antibodies, or we can say anti-HLA antibodies, which play a major role. Just remember this. Okay, Trali is something complication after transfusion within 6 hours, in which there is some role of anti-HLA, or we can say leukocyte antibodies. Okay,
Mhm.
yeah. Also, what you have to remember about, is my screen is visible properly?
Yes.
Okay. What you have to remember, that what is TACO? TACO is transfusion associated circulatory overload, which is characterized by high BP, which is absent in Trali. So you have to remember there is no role of high BP in Trali. TACO is different. That is transfusion associated circulatory overload, which is associated with high BP. Now, last but not least, about vacunators, what you have to remember, that purple have anticoagulant, the coating is EDTA. Purple have coating of EDTA, blue have coating of sodium citrate. We'll learn two by two. Okay, like this. Purple have EDTA, which is used for routine blood test. Okay. For blue, it's sodium citrate, that is coagulation study. It is used for coagulation study. Please repeat after me. Purple for EDTA, routine blood
Purple
test.
for routine blood test.
Repeat this.
Blue is for sodium citrate. It's for coagulation study.
Yeah. About gray, it's like sodium fluoride for blood sugar estimation, and red is for serology test. Repeat these two things. For gray, sodium fluoride for blood sugar estimation, and in this red, we have for serology test. Repeat after me.
Gray
Yeah.
Gray contains sodium fluoride and it is for blood sugar estimation. Red
Uh-huh.
is for in red we add a clot activator and it's for serology.
And about green, just you have to remember heparin, that is for the blood gas analysis.
Mm.
Just repeat the last one.
Oh, sorry. Green we add heparin and it's for blood gas analysis.
Yeah. So this is the important part about blood bank, which we are done with. Okay, you got the
Oh,
points. These are
yes,
the
yes.
key important point about blood bank, which you need to remember. That's it.
Okay. Okay.
Yeah, just a second.